us today for our transgender community, why pelvic health matters. Today we have Dr. Laura Meihofer. I'm always going to screw this up. Meihofer. And she's here to talk to us today about why pelvic health matters so much to the transgender community, and at what points we should really think about this, because we all got one. And so, Dr. Meihofer, say it for me. Pronounce.
You can call me Laura, just don't call me late for dinner. So,
ooh, all right. How about Dr. Laura?
Yeah, Dr. Laura sounds great.
Perfect. So tell us a little bit about what the pelvic floor is. Let's kind of start with the basics.
Yes. So the pelvic floor is a group of 26 muscles. It attaches behind the front of our pubic bone. So if you walk your fingertips down from your belly button all the way down to that firm bone, that's your pubic bone. And then it runs like a sling or a hammock and attaches into our tailbone and the bottom part of our spine, known as the sacrum. So these 26 muscles have to be able to do 4 major functions. They help to give stability to our spine and our hips. They deal with support of our pelvic organs, bladder and bowel continence, and sexual function. So no matter what genitalia you were born with, no matter if you've had a bottom surgery, everyone has these 26 muscles.
All right, and so let's kind of go a little bit into the surgeries. When you're having pelvic surgeries, how is the pelvic floor affected?
Yes. So I think this is, from a physical therapy standpoint, one of the biggest things I see for trans-identified or gender fluid patients, because a lot of times you're going to get these surgeries, this affirming care so that you can be your true self, which is so amazing. But when we think about having a vaginoplasty or even a phthaloplasty, what tends to happen is we're kind of restructuring things, we're reorienting things. So what can happen is we can start to have some dysfunction. So for example, with vaginoplasty, what they're doing is they're actually cutting away one of the muscles. So you go from 26 to 24 muscles. And then they're taking out some kind of spongy tissue that can help with blood flow. And then lastly, they're creating this internal canal, which sometimes shifts where your bladder and bowel is. So it can really affect how you contract and relax those muscles. When we're thinking about phthaloplasty, they're taking that middle canal and they're actually sewing it together, and that can create lines of tension that can sometimes give people back pain, hip pain, abdominal pain, because again, they're taking something that looks more like a bowl structure and they're almost making it a plate because they're pulling it together. And so again, that can kind of affect how the pelvic floor functions.
Okay. And so is this something that is how can it optimize it if you start pelvic floor physical therapy, if you kind of do it before surgery?
Yeah, so whether you're starting pelvic floor PT or you're just sitting here thinking, gosh, what's happening with my pelvic floor? What's my function? I like to have people go through and ask themselves, whether it's alone or with me, ask themselves, do I have any difficulty with urination? Meaning, if I cough, sneeze, or laugh, do I leak? If I have the urge to go to the bathroom, can I defer it or delay it, or do I have to run to the bathroom? Can I start my flow of urine, and is it just a constant flow of urine, or is it a stop and start? So that will give you some insight into your urinary function. Bowel function, you should be having a bowel movement about every 3 days. If it's usually we like to see it daily, but if it's 3 days or more, then you're constipated. If you're having strain, if you're having pain with bowel movements, then we know you have some pelvic floor issues and you need to come into PT. The back and the hip are also part of our pelvic floor function. So if you have any back pain or hip pain, you need to be mindful of that. And then finally, sexual functioning. So obviously, for someone who is trans-identified or gender fluid, sexual functioning can be charged in a lot of different ways. So seeing, is my sexual function where I want it for me personally? Not necessarily am I having erections or am I having maybe middle opening lubrication the way that I want to? Not necessarily that. Just, is your sexual function where you want it to be for you? And if it's not, then again, that's something that we can help with. And I always think it's great to do this before surgery, if possible, especially if you have any issues, and then also after surgery, because again, angles kind of change. And so we want to make sure that you're going to be able to have a healthy pelvic floor right after surgery, but then also as you age through life.
Yeah. And that sexual function is, is such an important piece to so many people. And so it's great that, we think about it throughout the entire process, before, during, after. And so what should they look for following the surgery? So should they reach out? They should obviously be with a provider before, and then how can they kind of optimize that function? We might have kind of covered this a little bit,
Yeah.
but sexual normal activities. How do they find a provider that is going to be trans friendly for them?
Yes. So let me go to your let me answer your first piece of, again, kind of trying to see their function afterwards. So say you're someone who maybe doesn't have a trans-friendly provider in your area. Maybe you don't feel comfortable going into someone. Maybe you don't have the funds. So we already covered how you can kind of self-screen, asking your own questions. But another way that you can check on your pelvic floor specifically after surgery is just seeing if you can contract your pelvic floor and relax your pelvic floor. So actually today, and I believe tomorrow or the day after, I'm posting how to do the voluntary and involuntary contractions of your pelvic floor on my Instagram. So people can check that out, but we can practice right now. So if everyone kind of gets into a comfortable sitting, standing, laying down position, think about that space that's right kind of in front of your rectum, so more towards the front of your body, but then right behind kind of where you urinate from. So kind of the middle part of your pelvic floor. Go ahead and try to tighten that area as if you're stopping the flow of urine or trying not to pass gas. You should feel it go up. That's called a voluntary contraction. Now, let that go, relax. If you cough, if I give a good cough, you should feel that same area tighten and lift up. That's an involuntary contraction. So both of those are important. Now, the next one is relaxation. If you bear down or strain like you're trying to pass gas or trying to urinate, you should feel your pelvic floor move down. Okay. If you take a nice, deep, relaxing breath in and out, you should feel your pelvic floor move down. So this is a really simple way to check in with your voluntary and involuntary contractions and relaxations. And I especially love people to do this after surgery because you'll notice you'll get better and better and better with time. And if you can't appreciate it, again, that's something that you can talk to your doctor about that will help with medical coverage for pelvic floor physical therapy afterwards. So now the second point of your question with talking about how to find trans inclusive and competent care.
Yes.
There are Yeah, that's the challenging thing. You know, I love how your company, Heather, went ahead and made your logo rainbow colored. I think it's beautiful being able to create a space where individuals can see themselves in the environment is really, really amazing. Um, but one of the biggest things is kind of being able to find this collection of PTs. So you can go to, and I have a video on this about how to find a pelvic floor physical therapist in your area on my YouTube channel, Laura Meihofer LLC. And in the description box, it has clickable links. But basically, you can go to pelvicguru.com. You can go to hermanandwallace.com. And then you can also go to the American Physical Therapy Association Move Forward website. So I believe that's APTA Move Forward website. And on each one of these websites, you can search with your zip code and your search radius. And some of them even have buttons that you can click to say trans friendly or trans competent. So that's
Oh,
one way to find people. But then I always say go a step further and look at their Instagram if they have one. Look at their LinkedIn. Look to see their website. See if you can see yourself in that space. And then the last thing is I find it helpful to call ahead. Now, as a trans person, you're constantly advocating for yourself. So if you have an ally that can call for you and kind of take on some of that stress for you, please do that. But if you can't, you can go ahead and ask these 3 questions. So, do you treat trans patients after vaginoplasty? How frequently do you treat or phthaloplasty or whatever surgery you had, or just if you're a trans person, how frequently do you treat these people is the second question. And then the third question is, do you do internal and external evaluation and treatment? So there are many physical therapists who say they treat the pelvic floor, but they never actually look at your pelvic floor. And it is completely up to you to consent or not to consent for that happening. But I do think it's important that the physical therapist has that baseline knowledge of how to assess that, even if you don't choose to have them touch your pelvic floor.
perfect. And do you recommend at any point that any of them get in, you mentioned more kind of doing that pelvic activity. Do you recommend that any of them throughout this do any type of dilator work, wand work, anything like that throughout that process?
Yes, so I completely recommend that. I'm just going to go ahead and make sure canceling on because I got a little bit of feedback. Let's see. Believe it is canceled or toggled. Let me check one more time. Everyone bear with us and
Technical difficulties.
Yes. Okay, so it is toggled. Okay. So, for doing the dilator therapy and wand therapy, so if you are someone who was born with a middle opening, okay, I recommend, if you can, seeing if those muscles are tight and tender. So before surgery, it can be helpful to do some manual techniques to that area. And so that can be applying a dilator to make sure that those tissues are nice and flexible. Okay.
Okay.
And then, but if that doesn't feel congruent to you, you can also do restorative yoga postures like cat cow, child's pose, and happy baby. The reason why I like all of these postures is they actually help to relax and lengthen the pelvic floor muscles. So you can do it without actually having to like be in that genital area if it is triggering to you. Okay. And then if you're someone who was born with a phallus, I like to have people start with the restorative yoga and the deep breathing. And then after surgery, you're going to be put on a very extensive dilation program. And if you tend to have any tenderness, using a pelvic wand to massage through those tender areas if dilation is challenging can be really helpful. And the great thing about dilators and wands is that they're much more cost effective than going directly to a physical therapist. So if access is an issue, you can totally use these like aids as a way to be helpful to your tissues.
Perfect. And I think they put our most recent, our Easy Magic Pelvic Wand up here.
Yes.
A little bit of information about that. That's made of a borosilicate glass. And you think glass and you're like, oh my gosh, it's going to break, it's going to chip. And that is not the case. This is a very unique type of glass. You can drop it from high points. It's not going to chip, right? The best thing about it is unlike silicone and other things like that, completely non-porous. You can heat it, you can cool it, whatever you'd like to do to kind of, and Dr. Laura, of course, would go through that with you of whether you should be using hot or cold and at different times.
Yeah, and that's the nice thing is I think when we're looking at tools to utilize in this setting, you want to make sure that you can have things that are really versatile. So being able to have something that you can cool, especially after surgery, can really help with pain management. Then once all of your incisions are healed, using something that you can heat up to kind of get tissue lengthening and increase blood flow can be really, really helpful. So whenever we're thinking about any of this stuff, I really like to think of it super holistically to be like, okay, how can we get multiple things to help patients feel successful and also feel in control and not necessarily have another provider kind of in their space as for some people it can be triggering.
Yeah, definitely. And I see here, Juno, it says, I am comfortable talking about these things to my medical providers, and I don't mind checking a provider for someone local if they don't have a friend to call for you. So that is amazing.
Yes.
I know that many people don't feel that level of comfort. And so kudos to you, Juno.
And I love that because, I think that's been one of the most incredible pieces of working with this amazing community is I find that there are so many internet like resources out there and Reddit things and all of this. So I love doing talks like this because oftentimes I find that these find their way into the kind of the Reddit sphere or different support pages. I also kind of want to talk about your Relivium cream, which I have had a lot of has been super successful for patients either prior to phthaloplasty who are having some pain at the middle opening, or for people after vaginoplasty who are having some pain on some of the scar tissues for dilation or for intercourse. And so that Revellium cream I have people apply it sometimes like 1 to 5 minutes before they're going to do whatever activity they're going to do. And it really helps to make things a lot more tolerable. So that's actually one of my favorite products from you guys.
Yeah, that's our. So originally, it's become very much a multi-use product. Originally, we developed it for cancer patients undergoing radiation treatment. So it's an all-natural patented blend of plant botanicals. It's 96% natural, 4% lidocaine. And what makes it so much different than like a lidocaine gel is a typical lidocaine gel maybe lasts maybe 1 to 2 hours. And because of our concentrated aloe vera being in there, acting as a carrier to make it more systemic, it typically lasts anywhere from 4 to 6 hours on average. But you can reapply every 3 hours. So
That's awesome.
we find that a multi-use product. I think around the office, so if someone gets, bumps into something and it's like, where's the Relivium?
Yeah.
So multi-use.
Yeah.
So, and then same, and back to the wands, I did want to mention, we do have two sizes. We have the Easy Magic and Easy Magic XL. So when you think about XL, it's for harder to reach areas if you need to reach behind. That those are just really the two differences between it, is just depending on length to where you need to get to. The Easy Magic is kind of our standard size. The XL is a little bit.
Which I really like that feature because, again, as I've been saying, and to all of the lovely individuals who are watching this, say you are someone with a middle opening and it is triggering to work in that area. There are tools and techniques like these wands where you can do like rectal or anal techniques. So we don't, whenever you're going to a provider, if they say it has to be done in a certain way, I am telling you, there are 5 million different ways that we can do something. I'm from the Midwest. My dad always told me there's more than one way to skin a cat. And that is the way I think about physical therapy is if you don't want anyone by your genitals, we can do a ton of work through your abdomen, your low back, your butt muscles, your inner thighs. If you're someone who doesn't want someone by your middle opening, or after a vaginoplasty, you still don't have someone comfortable there, but like rectally, you're okay with someone being in that area, we can do work through there, or vice versa. So again, there are so many ways to go about it. Please never feel like you're being pigeonholed down a certain way, because that's just completely untrue. There's lots of ways we can help.
And I know they brought up the AlloGlide a little bit earlier. So that's our 100% natural sexual lubricant. Just so that everybody understands, we really recommend that for vaginal use because that is pH balanced and isoosmolar specifically for the vagina. And when we say isoosmolar, this is how the water flows in and out of the vaginal wall, the epithelial cell layer. And when you add chemical ingredients, that can dry that out. And now over time, that can just literally fall out. So you've lost your barrier of protection to yeast, bacteria, STIs. And the same thing can happen anally. And so we are actually in the middle of, don't read what you read up here. That's not right. So anally, what you want to use is, we are actually in the middle right now. Most people go to silicone-based, other things like that, because you're not going to make any moisture in that area, whereas the AlloGlide helps you make your own moisture vaginally. So actually what we are doing is developing an anal version that will be pH balanced for the anus specifically. So this will actually be more alkaline, which is what the anus needs. Because if you use the AlloGlide, which is more acidic, made for the vagina, that same epithelial cell layer in your anus it's even more sensitive than the vagina. It will literally dry out and fall out in like 2 seconds. And then again, you've lost your barrier of protection. And so it is very important that when you are looking for a lubricant, that you are looking for something that is very alkaline. And you do not want something acidic that is made for the vagina. And so just keep that in mind. Desert Harvest will be coming out with an anal lube this year, specifically for this reason. We wanted to be able to create something that was an alternative to silicone that was all natural. But that would maintain that slipperiness throughout, would not dissipate, and also be pH balanced.
That's awesome. I love that.
Yeah. So, well, anything else that you think that we should cover or that we're missing?
I think that this would be super helpful, and I kind of alluded to it a little bit earlier, and we were really focusing on kind of the mechanics of the pelvic floor. But I do want to share with people that a lot of our diet movements really can affect our pelvic floor health. So as you're looking at like your body, and we've talked about different ways that you can screen yourself for care, whether you're actually getting motion, whether you're doing or whether you're asking yourself questions, all of that. Also, kind of take a look to see, and this might be a little taboo, what is happening when you have a bowel movement? What does your stool look like? Does it look like rabbit turds, or is it like flour served ice cream? Kind of ask yourself, how frequently are you going to the bathroom? Because again, there are things that I have lots of free resources on my website, but there are things you can do holistically without necessarily having to rely on a physical therapist. Again, I know access can be really challenging. So again, don't ever feel discouraged. But you can always reach out for questions or any of that, because there's lots that can be done. And if you can optimize your function pre-surgery or even wherever you are on your journey, that's going to be the best for you so you can live a long and happy life.
Perfect. And as you can see down here on the bottom, is this the best way? We've got a scrolling here across the bottom.
Yep.
You want to get in touch with Dr. Laura. You want to see her, ask her some questions. You've got her Instagram and her website scrolling here across the bottom. Thank you. Thank you so much. Actually, you know what? One thing we didn't tell, and that is not here. Where exactly are you? What is the name of your castle?
So I am located in Rochester, Minnesota, which is so funny that you said that, because I had a phone call today with someone and they're like, okay, so you're in Rochester, New York. Nope. I'm in Rochester, Minnesota, the Midwest. So I'm about an hour and a half away from Minneapolis, from the Twin Cities. And I'm located in the same area as Mayo Clinic. So it's really, really easy to find me. And we're also getting a message through here that we would love to answer any questions. So if anyone who's listening has any questions for Heather or I, please drop them in the chat.
Yeah, yes, definitely. Throw them in the chat. We'll be happy to answer. And again, if you do get questions that you're watching this after it's live, post them on our social, post them on our YouTube. We'll make sure that either myself or Dr. Laura, depending on what the question is, we'll get right back to you and get your questions answered, definitely. So,
yes.
All right. Well, I think we are. Yeah, and I think we're in the middle of the day, so we're probably going to get more of this.
Yes.
All
So
right.
definitely, thank you so much, Heather. I'm so excited for that anal lubricant, because I've been loving your the aloe one, the vaginal lubricant, vaginal and middle opening lubricant. So yes, I can't wait for that.
Perfect, and thank you so much for doing this. This means so much to this community. I spent my week last week in New York City for Pride Week, and it was an yes, exactly. It was an epic experience, and I will say this is an amazing community with an amazing heart, and I hope that we can do more series together in the future and continue to educate. So thank you.
Thank you.